Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A client who has been scheduled to have a cholecystectomy expresses anxiety about having surgery. Which nursing intervention would be the most appropriate to achieve the outcome of anxiety reduction? 1. Providing the client with information about what to expect post-operatively. 2. Telling the client it is normal to be afraid. 3. Reassuring the client by saying that surgery is a common procedure. 4. Stressing the importance of following the physician's instructions after surgery. The correct answer is 1. Providing the client with information about what to expect post-operatively. Providing information can help to answer the client's questions and decrease anxiety. Fear of the unknown can increase anxiety. Telling the client not to be afraid, that the procedure is common, or to follow her physician's prescriptions will not necessarily decrease anxiety. The client diagnosed with chronic kidney disease is receiving oral sodium polystyrene. Which assessment data indicates the medication is effective? 1. The client's serum potassium level is 5.8 milliequivalents per liter. 2. The client's serum sodium level is 135 milliequivalents per liter. 3. The client's serum potassium level is 4.2 milliequivalents per liter. 4. The client's serum sodium level is 147 milliequivalents per liter. The correct answer is 3. The client's serum potassium level is 4.2 milliequivalents per liter. Sodium polystyrene is a medication that is administered to decrease an elevated serum potassium level. A potassium level within the normal range of 3.5 to 5.2 milliequivalents per liter, like in option 3, indicates the medication is effective. The elevated serum potassium in option 1 would indicate the medication is not effective. Sodium polystyrene is not used to alter the serum sodium level.
A client has been taking 30 milligrams of duloxetine hydrochloride twice daily for 2 months because of depression and vague aches and pains. While interacting with the nurse, the client discloses a pattern of drinking a 6-pack of beer daily for the past 10 years to help with sleep. What should the nurse do first? 1. Refer the client to the dual diagnosis program at the clinic. 2. Share the information at the next interdisciplinary treatment conference. 3. Report the client's beer consumption to the primary healthcare provider. 4. Teach the client relaxation exercises to perform before bedtime. The correct answer is 3. Report the client's beer consumption to the primary healthcare provider. Rationale: the nurse should report the client's beer consumption to the primary healthcare provider. Duloxetine should not be administered to a client with renal or hepatic insufficiency because the medication can elevate liver enzymes and, together with substantial alcohol use, can cause liver injury. Referring the client to the dual diagnosis program, sharing information at the next interdisciplinary treatment conference, and teaching the client relaxation exercises are helpful interventions for the nurse to implement. However, reporting the findings to the primary healthcare provider is most important.
The nurse is caring for a client diagnosed with an anterior myocardial infarction 2 days ago. Upon assessment, the nurse identifies a systolic murmur at the apex. The nurse should first: 1. Assess for changes in vital signs. 2. Draw an arterial blood gas. 3. Evaluate heart sounds with the client leaning forward. 4. Obtain a 12-lead electrocardiogram. The correct answer is 1. Assess for changes in vital signs. Infarction of the papillary muscles is a potential complication of an MI causing ineffective closure of the mitral valve during systole. Mitral regurgitation results when the left ventricle contracts and blood flows backward into the left atrium, which is heard at the 5th intercostal space, left midclavicular line. The murmur worsens during expiration and in the supine or left side position. Vital sign changes will reflect the severity of the sudden drop in cardiac output, decrease in blood pressure, increase in heart rate, and increase in respirations. A 12-lead ECG views the electrical activity of the heart, and echocardiogram views valve function.
A client is admitted to hospital for evaluation of recurrent episodes of ventricular tachycardia, as observed on Holter monitoring. The client is scheduled for electrophysiologist studies the following morning. Which statement should the nurse include in a teaching plan for this client? 1. You will continue to take your medications until the morning of the test. 2. You might be sedated during the procedure and will not remember what has happened. 3. This test is a non-invasive method of determining the effectiveness of your medication regimen. 4. During the procedure, the doctor will insert a special wire to increase the heart rate and produce the irregular beats that cause your signs and symptoms. The correct answer is 4. The purpose of EPS is to study the heart's electrical system. During this invasive procedure, a special wire is introduced into the heart to produce dysrhythmia. To prepare for this procedure, the client should be NPO for 6 to 8 hours before the test, and all antidysrhythmics are held for at least 24 hours before the test in order to study the dysrhythmia without the influence of medications. Because the client's verbal responses to the rhythm changes are extremely important, sedation is avoided if possible.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The pediatric unit charge nurse is making patient assignments for the evening shift. Which patient is most appropriate to assign to an experienced LPN/LVN? 1. A 1-year-old patient with severe combined immunodeficiency disease who is scheduled to receive chemotherapy in preparation for a stem cell transplant. 2. A 2-year-old patient with Wiskott-Aldrich syndrome who has orders for a platelet transfusion. 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. 4. A 6-year-old patient who received chemotherapy 1 week ago and is admitted with increasing lethargy and a temperature of 101 degrees Fahrenheit. The correct answer is 3. A 3-year-old patient who has chronic graft-versus-host disease and is incontinent of loose stools. LPN/LVN scope of practice includes the care of patients with chronic and stable health problems, such as the patient with chronic graft-versus-host disease. Chemotherapy medications are considered high-alert medications and should be given by RNs who have received additional education in chemotherapy administration. Platelets and other blood products should be given by RNs. The 6-year-old patient has a history and clinical manifestations consistent with neutropenia and sepsis and should be assessed by an RN as quickly as possible. A 6-year-old child who received chemotherapy and had anorexia is now cheerfully eating peanut butter, yogurt, and applesauce. When the mother arrives, the child refuses to eat and throws the dish on the floor. What is the nurse's best response to this behavior? 1. Remind the child that foods tasted good today and will help her or his body to get strong. 2. Allow the mother and child time alone to review and control the behavior. 3. Ask the mother to leave until the child can finish eating and then invite her back. 4. Explain to the mother that the behavior could be a normal expression of anger. The correct answer is 4. Explain to the mother that the behavior could be a normal expression of anger. Help the mother to understand that the child may be angry about being left in the hospital or about her inability to prevent the illness and protect the child. Reminding the child about the food and the purpose of the food does not address the strong emotions underlying the outburst. Allowing the mother and child time alone is a possibility, but the assumption would be that the mother understands the child's behavior and is prepared to deal with the behavior in a constructive manner. Asking the mother to leave the child suggests that the mother is a source of stress. A 3-month-old infant arrives at the health center for a scheduled well-child visit. The parents ask the nurse why the infant extends the arms and legs in response to a loud sound. Which response by the nurse is best? 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. 2. Tell the parents if the behavior does not change by 6 months, the infant will need further evaluation. 3. Remind the parents this is a normal response that indicates the infant's hearing is intact. 4. Reassure the parents that the behavior is normal and not an indicator of any problem such as cerebral palsy. The correct answer is 1. Inform the parents that this is a normal reflex that generally disappears by 4 to 6 months of age. The infant's behavior is consistent with the Moro and startle reflexes. The Moro reflex usually disappears by 6 months of age. The startle reflex usually disappears by 4 months of age. A hearing test is not based on response to loud sounds alone. Although it is true that further evaluation may be needed if the reflexes do not disappear, there is no need for the nurse to discuss this with the parents at this time. The infant's behavior is not consistent with cerebral palsy. While assessing a 29-year-old Gravida 2, Para 2 patient who had a normal spontaneous vaginal delivery 30 minutes ago, the nurse notes a large amount of red vaginal bleeding. Which nursing action would be the priority? 1. Check vital signs. 2. Notify the healthcare provider. 3. Firmly massage the uterine fundus. 4. Put the baby to breast. The correct answer is 3. Firmly massage the uterine fundus. Fundal massage would be the priority nursing action because it helps the uterus to contract firmly and thus reduces bleeding. The first 2 answer choices are appropriate nursing actions, but do nothing to stop the immediate bleeding. Putting the baby to the breast does release oxytocin, which causes uterine contraction, but it will be slower to do so than fundal massage. A 22-year-old Gravida 1, Para 0 woman is being given an epidural anesthetic for pain control during labor and birth. Which are appropriate nursing actions when epidural anesthesia is used during labor? Select all that apply. 1. Request the anesthesiologist to discontinue the epidural anesthetic when the patient's cervix is completely dilated to allow the patient to sense the urge to push. 2. Insert an indwelling catheter because the woman is likely to be unable to void. 3. Encourage ambulation to encourage descent of the fetal head. 4. Encourage the patient to turn from side to side during the course of labor. 5. Teach the patient that pain relief can be expected to last 1 to 2 hours. 6. Explain to the patient that she will feel very drowsy after the epidural is given. The correct answers are 2. Insert an indwelling catheter because the woman is likely to be unable to void, and 4. Encourage the patient to turn from side to side during the course of labor. Insertion of an indwelling catheter is indicated because the woman will usually be unable to void because of the effect of the anesthetic in the bladder area. Positioning the patient on her side enhances blood flow and helps to prevent hypotension. Changing maternal position encourages progress in labor. With epidural anesthesia, ambulation is not usually an option due to decreased sensation in the legs. It is not recommended to routinely discontinue an epidural anesthetic at complete dilation. A continuous epidural infusion provides pain relief throughout labor and birth. Drowsiness is not a common side effect with epidural anesthesia. Drowsiness would be more likely with the use of IV narcotics for pain relief in labor. Use of evidence-based practices with a laboring woman supports the perinatal core measure of reducing the percentage of women who are delivered by cesarean section. Which action by a newly graduated nurse during a delivery complicated by shoulder dystocia would require immediate correction by the nurse who is orienting her? 1. Applying fundal pressure. 2. Applying suprapubic pressure. 3. Requesting the immediate presence of the neonatologist. 4. Flexing the maternal legs back across the maternal abdomen. The correct answer is 1. Applying fundal pressure. Fundal pressure should never be applied in a case of shoulder dystocia because it may worsen the problem by impacting the fetal shoulder even more firmly into the symphysis pubis. This issue of patient safety would require the supervising nurse to intervene immediately. The other responses are appropriate actions in a case of shoulder dystocia. The nurse is administering a saturated solution of potassium iodide. The nurse should 1. Pour the solution over ice chips. 2. Mix the solution with an antacid. 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. 4. disguise the solution in a pureed fruit or vegetable. The correct answer is 3. Dilute the solution with water, milk, or fruit juice and have the client drink it with a straw. SSKI should be diluted well in milk, water, juice, or a carbonated beverage before administration to help disguise the strong, bitter taste. Also, this drug is irritating to the mucosa if taken undiluted. The client should sip the diluted preparation through a drinking straw to help prevent staining of the teeth. Pouring the solution over ice chips will not sufficiently dilute the SSKI or cover the taste. Antacids are not used to dilute or cover the taste of SSKI. Mixing in a puree would put the SSKI in contact with the teeth.
After discussing asthma as a chronic condition, which of the following statements by the father of a child with asthma best reflects the family's positive adjustment to this aspect of the child's disease? 1. We try to keep him happy at all costs. Otherwise, he has an asthma attack. 2. We keep our child away from other children to help cut down on infections. 3. Although our child's disease is serious, we try not to let it be the focus of our family. 4. I'm afraid that when my child gets older, he won't be able to care for himself like I do. The correct answer is 3. Positive adjustment to a chronic condition requires placing the child's illness in its proper perspective. Children with asthma need to be treated as normally as possible within the scope of the limitations imposed by the illness. They also need to learn how to manage exacerbations and then resume as normal a life as possible. Trying to keep the child happy at all costs is inappropriate and can lead to the child's never learning how to accept responsibility for behavior and get along with others. Although minimizing the child's risk for exposure to infections is important, the child needs to be with his or her peers to ensure appropriate growth and development. Children with a chronic illness need to be involved in their care so that they can learn to manage it. Some parents tend to overprotect their child with a chronic illness. This overprotectiveness may cause a child to have an exaggerated feeling of importance or later, as an adolescent, to rebel against the overprotectiveness and the parents.
The nurse is assessing a client who has had a myocardial infarction. The nurse notes the cardiac rhythm shown on the electrocardiogram strip below. The nurse identifies this rhythm as 1. Atrial fibrillation. 2. Ventricular tachycardia. 3. Premature ventricular contractions. 4. Sinus tachycardia. The correct answer is 4. Sinus tachycardia. Sinus tachycardia is characterized by normal conduction and a regular rhythm, but with a rate exceeding 100 beats per minute. A P wave precedes each QRS, and the QRS is usually normal. The client diagnosed with chronic kidney disease is taking aluminum hydroxide liquid. Which information should the nurse discuss with the client? 1. Drink at least 500 milliliter of water after taking the medication. 2. Do not drink any water for 1 hour after taking the medication. 3. Drink 2 to 4 ounces of water after taking the medication. 4. Eat 30 minutes prior to taking the aluminum hydroxide. The correct answer is 3. Drink 2 to 4 ounces of water after taking the medication. Liquid antacids should be taken with 2 to 4 ounces of water to ensure that the medication reaches the stomach. The client should not drink more than 4 ounces of water because water quickens the gastric emptying time. Antacids should be taken on an empty stomach and are effective for 30 to 60 minutes before passing into the duodenum. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client is receiving 6 milligrams of selegiline transdermal system every 24 hours for major depression. The nurse should judge teaching about selegiline to be effective when the client makes which statement? 1. I need to avoid using the sauna at the gym. 2. I can cut the patch and use a smaller piece. 3. I need to wait until the next day to put on a new patch if it falls off. 4. I might gain at least 10 pounds from the medication. The correct answer is 1. I need to avoid using the sauna at the gym. Rationale. Selegiline transdermal system is the first transdermal monoamine oxidase inhibitor. The client needs to avoid exposing the application site to external sources of direct heat, such as saunas, heating lamps, electric blankets, heating pads, heated waterbeds, and prolonged direct sunlight, because heat increases the amount of selegiline that is absorbed, resulting in elevated serum levels of selegiline. Cutting the patch and using a smaller piece will result in a decreased amount of medication absorption, most likely leading to a worsening of the symptoms of depression. The client should apply a new patch as soon as possible if one falls off to ensure an adequate amount of medication absorption. Selegiline is not associated with significant weight gain, although a weight gain of 1 to 2 pounds is possible.
A client with chest pain is prescribed intravenous nitroglycerin. Which assessment is of greatest concern for the nurse initiating the nitroglycerin drip? 1. Serum potassium is 3.5 milliequivalents per liter. 2. Blood pressure is 88/46. 3. ST elevation is present on the electrocardiogram. 4. Heart rate is 61 beats per minute. The correct answer is 2. Blood pressure is 88/46. Nitroglycerin is a vasodilator that will lower blood pressure. The client is having chest pain, and the ST elevation indicates injury to the myocardium, which may benefit from nitroglycerin. The potassium and heart rate are within normal range. The nurse is preparing to care for a 6-year-old child who has just undergone allogenic stem cell transplantation. Which nursing tasks should the nurse delegate to the assistive personnel? Select all that apply. 1. Stocking the child's room with standard personal protective equipment items. 2. Teaching the child to perform thorough hand washing after using the bathroom. 3. Reminding the child to wear a face mask outside of the hospital room. 4. Assessing the child's oral cavity for signs and symptoms of infection. 5. Talking to the family members about the ways to reduce risk of infection. 6. Talk to the parents about local community and healthcare resources that will support the family after discharge. The correct answers are 1. Stocking the child's room with standard personal protective equipment items, and 3. Reminding the child to wear a face mask outside of the hospital room. Because all patient care staff members should be familiar with standard personal protective equipment, an AP will be able to stock the room. Reminding the child to wear a face mask is also a task that can be done by an AP, although the nurse is responsible for the initial teaching. Initially, teaching the child a good hand-washing technique, nursing assessments, and family education is within the scope of the nurse and not an AP. Talking to the family about local resources post-discharge should be done by either the nurse or the social services department. A nurse is teaching a client about taking antihistamines. Which of the following instructions should the nurse include in the teaching plan? Select all that apply. 1. Operating machinery and driving may be dangerous while taking antihistamines. 2. Continue taking antihistamines even if nasal infection develops. 3. The effect of antihistamines is not felt until a day later. 4. Do not use alcohol with antihistamines. 5. Increase fluid intake to 2,000 milliliters per day. The correct answers are 1. Operating machinery and driving may be dangerous while taking antihistamines. 4. Do not use alcohol with antihistamines. And 5. Increase fluid intake to 2,000 milliliters per day. Antihistamines have an anticholinergic action and a drying effect and reduce nasal, salivary, and lacrimal gland hypersecretion, runny nose, tearing, and itching eyes. An adverse effect is drowsiness, so operating machinery and driving are not recommended. There is also an additive depressant effect when alcohol is combined with antihistamines, so alcohol should be avoided during antihistamine use. The client should ensure adequate fluid intake of at least 8 glasses per day due to the drying effect of the drug. Antihistamines have no antibacterial action. The effect of antihistamines is prompt, not delayed. A 7-month-old infant arrives at the health center for a scheduled well-child visit. When the nurse approaches the infant to obtain vital signs, the infant cries vigorously and clings fearfully to the mother. Which of the following phenomena provides the best explanation for the infant's behavior? 1. separation anxiety. 2. Dissociation disorder. 3. Stranger anxiety. 4. Autism spectrum. The correct answer is 3. Stranger anxiety. This infant is displaying stranger anxiety. The child becomes anxious when exposed to unfamiliar people. Separation anxiety occurs when the child is separated from the primary caregiver. Anxiety and crying are also common behaviors. Stranger anxiety and separation anxiety are concurrent and generally begin at 7 to 8 months of age. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2 and 4. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code card is not needed at the bedside.
A 36-year-old Gravida 1, Para 0, patient has received an epidural anesthetic. Her cervix is 6 centimeters dilated. Her blood pressure is currently 60/38. Which nursing actions would be the priority? Select all that apply. 1. Place the patient in high Fowler position. 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. 4. Prepare for emergency cesarean section. 5. Decrease the IV fluid rate. 6. Observe closely for fetal heart rate decelerations. The correct answers are 2. Turn the patient to a lateral position. 3. Notify the anesthesiologist. And 6. Observe closely for fetal heart rate decelerations. The patient may be experiencing supine hypotension caused by the pressure of the uterus on the vena cava and the effects of the epidural medication. Maternal hypotension can cause uteroplacental insufficiency, leading to fetal hypoxia. Placing the woman in a lateral position can relieve the pressure on the vena cava. The anesthesiologist should be notified and may need to treat the patient with ephedrine to correct the hypotension. Fetal heart rate decelerations are common if maternal hypotension is not promptly corrected. IV fluids are increased per protocol when supine hypotension occurs. A 27-year-old patient underwent a primary cesarean section because of breech presentation 24 hours ago. Which assessment finding would be of the most concern? 1. Small amount of lochia rubra. 2. Temperature of 99 degrees Fahrenheit. 3. Slight redness and pain of the left calf. 4. Pain rated as 3 of 10 in the incisional area. The correct answer is 3. Slight redness and pain of the left calf. Slight redness and pain in the left calf could be suggestive of thrombophlebitis and requires further investigation. The other findings are within normal limits for this point in the postpartum and post-operative course. When administering a thrombolytic drug to the client who is experiencing a myocardial infarction and who has premature ventricular contractions, the expected outcome of the drug is to 1. Promote hydration. 2. Dissolve clots. 3. Prevent kidney failure. 4. Treat dysrhythmias. The correct answer is 2. Dissolve clots. Thrombolytic drugs are administered within the first 6 hours after onset of an MI to dissolve clots and reduce the extent of myocardial damage.
Upon assessment of third-degree heart block on the monitor, the nurse should first 1. Call a code. 2. Begin cardiopulmonary resuscitation. 3. Have transcutaneous pacing. 4. Prepare for defibrillation. The correct answer is 3. Transcutaneous pads should be placed on the client with third-degree heart block. For a client who is symptomatic, transcutaneous pacing is the treatment of choice. The hemodynamic stability and pulse should be assessed prior to calling a code or initiating CPR. Defibrillation is performed for ventricular fibrillation or ventricular tachycardia with no pulse.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.